Now, what are the advantages to FUE? Well, when you take tissue out of the donor area and put it in a holding solution, it continues to burn energy. It burns up adenolates. You have an increase in intracellular sodium, a decrease in intracellular potassium, an increase of intracellular calcium. You get a change in the consistency of the cell membrane and organ membranes, which causes them to be leaky. You get an accumulation of free radicals and oxidative byproducts. So you get a host of things that are happening that all lead to programmed cell death or apoptosis. So it's always been my belief that we should try as best as possible to return our grafts from the donor area to the recipient area as quickly as possible. And there's no procedure out there that allows for a faster turnover time from donor area to recipient area than FUE. You get more hair per graft with FUE. You average actually 1 hair per graft more. Now, what that means is that if you look at the cost of FUE by hair, you'll see that if you pay $8 per graft for FUE by hair, that's equivalent to a graft cut by strip that's only $5.33. For example, suppose you pay $5 a graft for 1,000 strip grafts, $5,000, and you average 2 hairs per graft with strip surgery. You pay $2.50 per hair. But if you paid $8 a graft for FUE, that would be $8,000, and you would get 3,000 hairs, but only $2.67 per hair. So in essence, you're paying only 17 cents more per hair for FUE for a graft that's cut by a physician, not a technician, and you avoid the strip scar. You avoid all the complications that ensue as a result of strip scars. So in my opinion, the small increase in cost is well worth it. Now, there are other advantages. For example, you will get a better result with fewer grafts. Why? Because you get more hairs per graft and you get outstanding yields. Your physician will cut the graft, not the technician. And it's a less invasive procedure. You'll have faster healing and a shorter recovery time. Now, in 2002, very few physicians performed FUE. A handful began to devote their practices to FUE, all based on the experiences with Dr. Woods. But you may not be aware that over 11% of all hair restoration surgeries in 2008 were done by FUE. In other words, the percentages of patients who are restoring their hair by FUE is increasing, exponentially increasing, while the percentage of patients who have strip surgery is declining. This is a procedure that is taking root, it's taking hold, and it's doing so because it offers you the opportunity to get a better overall aesthetic result in your donor area. What you need to do is choose a physician, just like you would for your strip procedure. Choose a physician who dedicates his practice to FUE, somebody that has documented consistent results, somebody that perhaps has had proper training in FUE, somebody that really believes in it. You know, if you believe in your heart that your strip procedures produce a better result than your FUE procedures, in my opinion, you really should not be performing many FUE procedures, and perhaps you should only focus your FUE procedures on repairing your strip scars for your patients, and probably at no charge. So, having said all that, I can honestly tell you, my opinion is that FUE, though slightly more expensive than a strip procedure, hands down, is a better way to restore your hair. You avoid the strip scar, you get outstanding results, you get no distortion of hair growth angles, you have the option of growing your hair slightly shorter and maintaining a shorter hairstyle, and you may even be able to shave it completely. You know, some patients do get some white spotting, what some physicians call moth-eaten appearance. You know, the more and more hair you take out of the donor area, the higher the probability is that your donor area is going to be thin. You may not be able to shave it to a bic, but you certainly should be able to get it to a 1 or 2 guard, and this is certainly hands down better than the result you're going to get with a 1 or 2 guard with a strip procedure after you've had 5, 6, 7,000 grafts taken out of the back of your donor area. Well, appreciate your time, and I hope I've answered some of your questions about FUE.